breathtaking stunning sights, incredibly extensive large greenery. Variety of wild animals and bird species. A wide range of luxury holiday facilities. Diverse, rich culture. The home of beautiful, welcoming, hospitable people. Uganda, the Pearl of Africa.
In chess, the small one can become the big one. It's the same here. And here too. Watch every move. Record every number so you can plan better. No matter the size of your dream, tomorrow's success belongs to those who keep today's records clean. File your returns today.
Uganda Revenue Authority, developing Uganda together.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Century Points when you deposit, send and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
A very good evening to you tuned in to UBC TV. Welcome to our news tonight. First, we'll start with an apology. We had to be here at exactly 8, but we have lost 10 minutes because of a technical glitch that we had to put right. It is now in the right form, and here we are with news tonight. My name is Micheal Jordan Lukomwa. Elizabeth Nakakoni joins in for sign language interpretation. In a first story tonight, President Yoweri Kaguta Museveni plans to increase the number of ministers in the new term of office by 1, a slot he says will be for a state minister. This will now bring the total number of the ministers to 80 compared to the previous that had 79. The president was addressing the NRM party caucus at Kololo ceremonial grounds in Kampala.
President Yoweri Kaguta Museveni has met NRM members of parliament at Kololo ceremonial grounds in Kampala. The MPs who were meeting to elect the parliamentary committee chairpersons were instead given forms to express interests and, according to the party secretary general, will be processed after appointment of the cabinet and state ministers.
Your Excellency, sir, as your secretary general, I want to take this opportunity. My members, even clapping, they are so slow, they don't have much energy. Because they are waiting for those deployments that you are supposed to do soon. Energize people so that you deploy some first level, second level, third level, deploy all in parliament. That's the pill that is missing. Welcome, sir. So, Your Excellency, on the issue of the committees, members are filling forms. We shall process them after you have appointed ministers.
It's from here that President Museveni revealed that he is going to increase the number of ministers by one, a slot he says will be for a state minister.
I want to maintain more or less the same numbers, but with one additional minister of state from the present numbers, the ones we have now. Because the numbers we have now are total of 79, if you include the ministers of state. So I intend to propose that I add one minister of state to the present lineup.
But then, because he has to follow the legal processes, he will only increase the number of the current ministers from 79 to 80 after a prime minister and a vice president are in place.
So the idea was that I publish the list, which I will do very soon. Then you meet as parliament and you approve or reject my vice president and my prime minister, and then the prime minister is the one who now brings that motion. That's what I was told.
The president also applauded the NRM lawmakers for solidarity they exhibited during the speakership elections.
And secondly, I want to thank you for the way you conducted yourselves in the election of the Speaker and the Deputy Speaker. Thank you so much. You behaved like parties behave. Because politics is not about what you want as an individual.
Philip Aguta, UBC News in Kampala.
6th of June COVID-19 address directed new standard operating procedures to curb the drastic spread of the coronavirus in Uganda. According to the Health Ministry, Uganda recorded 1,259 positive COVID-19 cases out of the 7,424 tests that were carried out on the 4th of June 2021, the highest number recorded in a single day, and this informed the new measures instituted. In his speech, he emphasized that Ugandans ought to take the second wave seriously by being vigilant and abiding by the newly established standard operating procedures.
81 districts have recorded high sustained transmission of the coronavirus in the last 2 weeks. Among these include Kampala, Wakiso, Gulu, Luwero, Mbarara, Mbale, Tororo, Moroto, Masaka, Busia, Nabilatuk, Amuru, Lira, Moyo, Arua, Lamo, Kalungu, Rubirizi and Yumbe.
Should cases rapidly escalate and overwhelm the above bed capacity, government will install a 300-bed field hospital per regional referral hospital, thus providing an additional 4,500 beds. That is to say, if the problem becomes worse, then near the referral hospital, we build tents.
Currently, There is diffused and sustained COVID-19 transmission in the 81 districts, where the highest burden districts are Kampala, reporting an average of over 500 cases per day, followed by Wakiso and Gulu, which have consistently reported over 100 cases per day.
I call upon all district leaders, including LOCs, cultural and religious leaders, to use existing structures and systems to ensure that SOPs are observed in the villages and during village functions, and the village health teams are supported to mobilize people to report illness and support communities as guided in the Ministry of Health guidelines for home-based care and support.
By age group, the distribution of the 12,564 confirmed COVID-19 cases between 1st March and 6th June of 2021 shows that 0 to 9 years have been recorded to be over 500. 10 to 19 years have been recorded to be over 1,100. 20 to 29 years have been recorded to be over 2,700. 30 to 39 years have been recorded to be over 3,200. 40 to 49 years have been recorded to be over 1,800. 50 to 59 years have been recorded to be over 900. 60 to 69 over 400. 70 to 79 have been recorded to be over 200. For people over 80 years, 100 cases have been confirmed.
Uganda is expecting to receive an additional 175,000 doses for the vaccine through the COVAX facility. This is AstraZeneca. So please, you people, you vaccinate second round, the ones who have already. Yes, first finish those. Because if you don't, then that one will be wasted. In fact, I wouldn't want you to vaccinate new ones until you finish second round the other ones, so that we have that complete group.
As government mobilizes the population for vaccination, installing a 300-bed field hospital for regional referral hospitals are in the pipeline. Schools, institutions of higher learning, places of worship, public gatherings, non-food markets and inter-district travel have all been suspended for 42 days in order to curb the further spread of coronavirus. Wadulo Makano, UBC News.
Uganda police has instructed territorial commanders to create local support teams to enforce the observance of the anti-COVID-19 regulations. Uganda police spokesperson Fred Enanga says this will strengthen community policing.
To come up with the local support teams, even in markets like Kowino, Chikubo, places like Karerwe. If they come up with local support teams and even get reflector jackets for those locally mobilized teams that can work with the police and other stakeholders, we are encouraging that.
They will also collect videos as evidence in court proceedings.
Record an activity where they are flouting the SOPs in place, and then you avail those videos to us. We shall go back and identify people in those footages and then issue very heavy fines to them.
Uganda police has also responded on the presidential directive on giving traffic officers rifles.
I think it's going to remain that way until we acquire a sufficient number of pistols to arm the traffic officers, because you can't give a traffic officer an SMG to carry the SMG and at the same time, you know, so they need something that is convenient to help them in the enforcement. So the pairing with the general duty officers is going to continue until when we have sufficient number of pistols for them.
The police ICT department is undertaking radio call assessment to restore its operations. In this direction, signal operators have started training.
It has been brought back under operations because it is an operational function to be communicating on radio. So we've gone back to the traditional way of communication of the Morse code, and we had already trained a number of signalers who have now been deployed. So we have reactivated the radio call, the use of walkie-talkies.
Despite allegations of extortion, police will continue with the traditional ways of fining lawbreakers as they wait for guidance from the Secretary to the Treasury.
Even if the fine structure is not yet released, we are still using the old system of issuing EPS tickets, fines and penalties through court to defaulters and violators.
For proper enforcement of the anti-corona regulations, crime intelligence officers have been deployed in strategic places like tax parks, malls, busy places for quick response. Abdul Nasir, Lukomwa, UBC News.
Institutions of higher learning have closed operations for 42 days to check the spread of COVID-19. They also issue messages to instruct wardens of halls of residence to tell students to vacate the campus. This directive has, however, interfered with most university programs since some were about to begin end of their semester examinations.
At the entrance of Buganda Royal Institute, Mengo, students are vacating the school premises with all their belongings to return home. It follows a presidential directive to close schools for 42 days to prevent the spread of COVID-19. The quickest means of transport was using border borders. Students loaded suitcases, mattresses and other personal belongings and left. Students say it is the second time schools are being closed and it affects their progress. They claim it will make them stay in school longer.
So we're gonna miss what we call skills from the technical. And another thing is that now we are going to put a burden at a burden to our parents at small scale businesses. For instance, me I want to buy some chickens, some hens so that they can hatch and do.
We had a lot of papers, and then abruptly we are going home, yet we paid school fees, tuition there. So we are not okay at all.
She hurted us because we are going to be graduated next month on 9th. So I don't know when we are going to be graduated.
Efforts to capture scenes inside the school gate were frustrated by the gateman who denied access. At Macquarie University Micheal Hall vehicle parking lot, students loaded their belongings to return home. They say the university, through the dean, directed wardens of the halls of residence to tell students to leave. International students were left stranded.
Last time, because we come from far, we have international students here. They haven't given students time. There's a letter that has been issued today at around midday, 11:30. That was issued that students should leave vacate halls of residence by the end of today, and students have not yet gotten transport, to
conclude with this semester, because we are delaying so much in school. But then we believe that probably this was the best solution, and we respect the order given by the president.
Third-year students had completed exams, while continuing students were due to start on Monday, 7th June.
The remaining students, the continuing students, were supposed to begin. I can tell you that at Makerere, without completing tuition, you cannot sit for an examination. So I can say 99% had definitely completed their tuition.
As a person also, I didn't have a tuition, and I was starting my exams today. So my president has helped me so much.
Nevertheless, President Museveni directed taxis, buses and private cars to stay in their respective districts starting 10th June. This would give parents chance to pick their children from school. Meanwhile, at Caltech Academy, students were leaving the campus. But school administrators say they were left nursing losses after they had purchased resources for the students' stay at school.
Like we have stocked a number of things like food. Our service providers have provided things at school, some of which we have not paid. Yet some of these students had not cleared school fees yet. So
they also appeal to parents to ensure safety of learners during the lockdown.
Have got pregnant. They have been involved in very many bad behaviors. All this awaits them in this lockdown again. So I encourage the parents to keep these kids safe.
I'm Nafka Farida and Daniel Lukomwa in Kampala.
Universities closing operation. The overwhelming numbers of people for vaccination against COVID-19 has led to the reduction of the vaccines, hence calling upon government to support. The nursing officer at Chisenyi Health Center for Baluka, Winfred Viola, said that first timers missed the COVID-19 vaccination jab.
The declaration of the 42 days of lockdown due to the increase in cases of COVID-19 has rushed people for vaccination.
We've handled about 90 clients today. That is very small compared to the numbers we've been handling. Just because the drugs have reduced, so we are trying to consider majorly those who are taking the second dose.
Statistics show that a number of people admitted to intensive care unit has increased because of COVID-19, forcing many to take the jab.
Government really has to help. We really need more vaccines. People are interested, but the vaccines are not really so enough for everyone. And maintaining the SOPs, it is really a big challenge.
Chisenyi Health Center for Nursing Officer advises all those not vaccinated to be patient.
Those that are turning up and they are from organizations, they are saying, the organization has asked me to take the jab because I need my job, but maybe I would not take the jab because I still have fears. Fears are into everyone's mind. They feel it is not safe. It is human, but along the way as you talk to them, encourage them, when you tell them you've been jabbed yourself and you're fine, they pick up and get encouraged. But the fears are there, you cannot take them away.
Shama Kuki from an Indian origin confirms that many Indians are dying and they are running out of burial places.
As the situation of India now, there is a shortage of the vaccine. People are dying in India like a paper. Even they don't have space where to bury the people. They are just throwing in the river and there is no space for their burial. So I'm humbly requesting all our brothers Ugandans, please come and get the vaccine. It's going to help in our body and our life.
abantu ate eddagala lya bwereere tuka ekiseera okubanga okyetaaga ate nga tukyasobola kukifuna essaawa eyo nga ate olina okyetaagisa nga ate ekyobwerere okirese ate tuke kukinakaluubiriza.
Sudat Kaye reporting.
Following last evening's COVID-19 presidential address to the nation and a 42-day national partial lockdown imposed on different sectors, downtown Kampala, there is compliance and adherence to the COVID-19 SOPs, as Robert Onyango tells in this story after visiting the area.
According to the president, over 500 positive cases of COVID-19 infections have for the last 1 week been recorded on a daily basis in Kampala Metropolitan. This attracted government to institute new nationwide measures where the president warned against non-compliance, a total lockdown to sectors such as transport, arcades, markets and malls as the last option.
We are observing when you enter in the building, you have to put on a mask and wash your hands before you enter in the building.
Meanwhile, students who flocked different terminals in Kampala to return home following the immediate closure of schools have found no means of transport and high fares.
Transport fares are quite high, contrary to the normal fares. At this time I'm told traveling is around 60 Western.
They have given us from today up to Thursday, right? So that means the bus leaving this place to say Kasese, Wondibucha, it is going to take people from here. The moment it reaches there, it will come back empty.
In the past days or hours, it seemed like a lion assignment. If one dared to tell you that go downtown Kampala and get him or her 2 or 3 people putting on face masks. However, the good news seems to be that after the presidential address last night, there is a sense of compliance and adherence to the COVID-19 standard operating procedures from city dwellers.
With the stringent guidelines to the transport sector and the curfew hours, some vendors in Kampala are opting to shelter at places of work.
Abantu abamu basazeewo okuddamu okusula mu katale okusobola okuba nti tetutambuza bulwadde okubusanza abali awaka ng'obujje mu katale.
COVID-19 vaccination in markets such as Owino and Nakasero is also being stepped up as one of the measures.
COVID is for real. If you don't want to do that, please don't enter in our market.
Working in shifts is being sought of as an immediate boost to observance of social distancing in some markets within Kampala metropolitan.
All we need money. You cannot say that you all don't work. No, let us make shifts for our vendors and our workers. If you have 4 workers, then let each one come on his or her day.
The president also issued a wake-up call to arcade operators and downtown Kampala.
Actually, it will affect our businesses, but we have nothing to do. We have to bear the rules of the president.
However, the transport sector is among those likely to be hit hard by the new presidential COVID-19 guidelines. Joint Taxi Operators Consortium, an umbrella anchoring different taxi operators, has however cautioned their counterparts on enforcement.
Tugimanyi emanyi okwetegereza bw'eraba tukutte bulungi ensonga esobola okututeerawo gaapu ne tugiranga tukola. Bwe munaaba temukikoze nze mbabuulidde buli muntu akaabire uwe mu nnyumba ate tokaabirira omuntu yenna kuba lockdown mwe mujja okuba mugireese.
New guidelines show that the transport sectors will be limited to only internal connections within districts starting Thursday 10th June 2021. Robert Onyango, UBC News, Kampala.
Police working with border leaders have impounded motorcycles in an operation on the riders who defied the guidelines in the city. This follows President Yoweri Museveni setting new guidelines in his address to the nation to curb the spread of COVID-19.
Following the president's address that set new COVID-19 guidelines, border riders would carry 1 passenger, observe SOPs as a mitigation measure to control the spread of COVID-19. Police and border leaders in Kampala have carried out an operation against those who defy the guidelines. The operations took place along Obakuli, Chisenyi, Musajja-Lumbwa roads. Borders carrying more than 1 passengers and riders without face masks had their motorcycles impounded to Old Kampala police station. Those into the sector and operating in the city were happy with the operation.
Border baberemu omukulembeze siyateekeddwa okulagira ate okwekukuuma obulamu bwo.
Tugulawo batugulirawo ku condition okuteekesa ebiragiro bya SOPs. Era nga ffe ababoda twaguddewo operation tuzikola n'abapoliisi.
At Chikubo, the center of business and trade downtown, leaders used public address systems to remind the city dwellers about observing SOPs.
Ffe tugezezzaako nnyo okulaba nti tuteeka mu nkola ebiragiro bya ministry y'ebyobulamu.
In another development, the president ordered closure of all schools and institutions of learning with effect from 8 o'clock today, and parents were to collect their children. Students carried their belongings on motorcycles as parents walked due to scarcity of vehicles. In taxi and bus parks, many people leaving the city for villages were stranded. They feared a total lockdown. They complained about transport fares that have been hiked.
It was 18, then when Corona started, it came to 30,000. At the moment, they're talking of 70,000. I don't know what's going to happen next. Sit here and wait and see what the president is going to do next.
However, those in the sector seem to have reasons for hiking the fares. Ivan Juko, UBC News.
Authorities in Lira are calling for government support to manage COVID-19 patients after its treatment center got full. The Director for Health in Lira District, Dr. Edmina Cheka, said that the center's 30-bed capacity building and the 60-bed capacity tent are all occupied by COVID-19 patients admitted recently, yet still receiving new admissions. Besides some recoveries, the center also lost 2 patients over the weekend.
Early this morning, schools closed and assembled students to go home following the presidential directive to curb a resurge of COVID-19 in the country.
Only that government should think about us.
Like for me, I've paid 400,000, but I've studied for only 3 weeks.
We have sent away a total of 460 students, senior 1 and 2, back home. The unfortunate bit is that the senior 2s who had stayed home for almost a year and they had lost a lot of time have again been unlucky.
And the girls child, I urge you really to be disciplined so that after this COVID you can still come back to school and start from where we have stopped.
But after leaving the school, most students were stranded at the bus park due to lack of transport.
Nowhere to go. Where are you going? Because for us we are going in young, but there is no transport.
You know, their safety is the future of our country. So it has been a very wise decision to protect the youth.
Although the park looked crowded, authorities at the park ensured SOPs are followed.
The numbers are
From here up to Kambini, the center, but if you put only 3 people, yet this vehicle needs fuel for almost about 70 hours.
However, Lira District Health Officer Dr. Eddie Monacheka is worried that the return of students might increase community infections.
Some of them have gone with the infection and they're going to infect the whole people in the community, and most of them, we are worried of their life.
We are here prepared to make sure that our people don't fall a prey of the virus.
All who are coming with difficulty in breathing, when we test with RDT, they are turning positive. And this is a very serious situation that we have currently in the district.
Over the weekend, Lira lost 2 patients out of the 11 admitted to the ICU, 42 others receiving treatment, and a 4-year-old also survived from the deadly disease, while 124 are receiving home care in schools and communities across the district. Ediolwa for UBC News in Lira City.
The number of increasing cases of COVID-19 at Entebbe Regional Referral Hospital as well has hit the capacity as patients with other illnesses discharge themselves from the facility. The principal hospital administrator, Mubidu Mohammed, says the overwhelming number of COVID patients has forced the administration to temporarily close the hospital to inpatients for 42 days.
This hospital contains 45 beds designed to handle 45 patients, but it is full with 63 patients, 25 critically ill in ICU.
For the meantime, we are overwhelmed unless
unless we expand the bed capacity. That means we are going to put these patients in spaces where the people who have been admitted for other conditions have been occupying. That's the logic for the meantime, until the National Isolation Center is open.
According to medical workers, patients with other illnesses like diabetes, AIDS are discharging themselves since they can't handle the current situation due to the ambulances bringing patients a minute.
COVID, and the ambulances kept in coming throughout the night and with the sirens. So the patients, since it's one complex, the patients who are of other conditions were in position to peep and see how these patients were. So in their own wisdom, they thought they were no longer safe to be attended to under the hospital. So many of them left, in fact, discharged themselves and went away. So
the current situation has forced the hospital administration to have an emergency meeting. The administration has agreed to temporarily close the facility so as to handle COVID patients for at least 42 days.
Outpatients are not zikora. Aho we bitanda bonna kibakirizibwa okujja ka abajja bajjanga bane badayeka.
However, they have also clarified on the ongoing COVID-19 vaccination taking place at the hospital, as they are still working only on those receiving their second jab.
Our target is we're only looking at the second dose. But also for this, because the numbers swelled and there was a lot of congestion, we had to first look at those who are taking the second jab, because for them there are timelines that we had to fulfill and follow up, because we are running out of time. Then after that, we shall also look at them. But we will handle first come, first serve. Even some staff have also not taken the first jab.
Currently, the hospital installed oxygen plants and ready to receive and attend to COVID patients. Mutonyi Helda and Sula Kagogube, UBC.
The Archbishop of the Church of Uganda, Dr. Stephen Samuel Kazimba Mugalu, has appealed to Christians to strictly follow the guidelines issued by the President on the prevention of the COVID-19 spread. He was addressing the media at Namirembe.
All Ugandans to adhere to the COVID-19 SOPs, wash hands with soap.
President Yoweri Kaguta Museveni issued strict measures that included the closure of schools, religious worship places, and suspension of inter-district travels for the next 42 days. He was updating the nation on the status of COVID-19. The Archbishop of Church of Uganda, Stephen Kazimba Mugalu, has also reinforced the guidelines to be followed by the clergies and Christians for the next 42 days.
I want to make it clear to all of us that this does not mean that churches are closed. No, churches are not closed. It's only buildings that are closed.
Kazimba has also urged clergies and lay leaders to observe the standard operating procedures.
Capacity for online streaming of worship services. I urge you to continue using YouTube, Facebook, and Zoom. We will continue to offer worship from home.
Meanwhile, Uganda Muslim Supreme Council has issued a statement to all Muslims, regional and district health, to abide by the presidential directive and Ministry of Health guidelines.
And we request our Muslim community members to hold their daily prayers at their homes, at their respective homes. And as well as we call upon all Ugandans to go and they should go for vaccination exercise, as was recommended by the health experts. That is the only way we can overcome this scourge.
Today, the new cases are 1,026, cumulating cases are 53,961, while recoveries are 47,760 and 383 deaths. Mutesa Sira Haruna, UBC.
Yes, Mutesa Sira Haruna brings us to the end of this first edition of News Tonight. We thank you so much for watching. But before we close, we apologize for having started 10 minutes late. We had a technical issue we had to solve. It has been solved, and we'll have news at 10 p.m. in a bigger arrangement as usual. My name is Micheal Jordan Lukomwa with Elizabeth Nakakoni and the whole team. Thank you so much for watching. Enjoy the evening.